Okay, now let's take a look at some tips on scoring respiratory events. So we always stage score before we do our respiratory event scoring. And I actually haven't stage scored this, but this epic is run. So epic 95 is run. Go back. Okay, now it's scored as run. Okay, so we have a couple of options here when we do respiratory events. So we're on epic 95. If I know that this is an epic where my patient is asleep, I do have the option of looking at just my respiratory channels. To do that, you're going to right-click. This box will appear. Hover over montage, and then click on respiratory. And then click anywhere outside that box to make that go away. So now we can see all of our respiratory channels up close. Notice on this one, we can definitely make out there is abdominal movement. We can definitely make out some chest movement, but it's kind of a little iffy what's going on here with our nasal pressure transducer and with our thermistor. So if we hover over this channel, I can actually change the size of these waves with these plus and minuses. If I hit minus, it makes it a little bit smaller. See, I went all the way down to 1, okay? Or I can increase it, and that's where we started, so I'm going to go bigger than that. Nope, I can't go any bigger than that. That's as high as it'll go. If we go to our pressure, let's see. Oh, that's the highest it'll go to, I suppose. Yep. Okay, so that is if you want to just look at the height or make the height of your waves bigger. To measure the distance, again, you're going to hold down your left mouse, and this is the first breath here that is visibly reduced from my baseline breath. So I'm going to hold down my left mouse, and then I'm going to drag it, and this here, right there, looks to be the beginning of the first breath, which returns to baseline. So by measuring this, I see this event here is about 16 seconds long. I would not say it is a 90% decrease in the wave. It's very irregular, that's for sure. And there is some airflow obstruction, and I can tell that from my nasal pressure transducer. I'll show you that in a minute here. So I would say that this is probably a hypopnea if we have a desaturation to correlate with it, okay? So this here is your nasal pressure transducer, and this is where you can tell airflow obstruction or not. Let's go forward in epic. Okay, the lowest saturation here is 95%, which occurs after the epic. So this is not a scoreable hypopnea because the event only goes from 97 to 95. Okay, now I want to go back to our normal view. So again, I'm going to right click, hover over montage, and then click on full to take us back to our normal screen. And then to make these boxes disappear, I just need to click somewhere outside of those boxes. Okay, another useful tool for scoring respiratory events is looking at your epics at a 120-second view rather than a 30-second view. Okay, right now we're looking at 30 seconds of time. We know that because it goes from 1 second all the way to 29, and this right here would be 30. So I'm going to right click, and then I want to change my epic duration. Currently I'm on 30 seconds. I want to change it to 120 seconds. Okay, now notice it's now we're looking at 4 epics. Okay, so 94, 95, 96, and 97. The epic, if we were to score anything, if it's going to score inside this red box, so it will score on epic 95. If I right arrow over, it moves to epic 96. So my red box didn't move. It shifted the entire record. Okay, I'm going to left arrow back to 95. Okay, so here we go. So here we can easily identify that there is a decrease in our thermistor, but it is not a significant enough of a decrease for it to be a scoreable apnea or hypopnea. Okay, let's go on to epic 96. same thing. It looks like a decrease in our thermistor by at least 30%, but not 90. However, looking at this view, it doesn't look like we have enough of a desaturation. We keep going. That looks okay. It looks like a little bit of a decrease here, but again, we're not going to have that desaturation with it. And again, I'm looking to see if we can find an apnea right quick. Okay, this one looks like it could be an apnea. Okay, from here to here, that is 90% or greater decrease in our thermistor. I do see movement in my nasal pressure transducer, and I do see movement in my abdomen and thoracic belts, so it could be an obstructive apnea. So to take a better look, I'm going to go back to my regular screen, so left arrow, or left click, go back to my epic duration, click on 30 seconds. Okay, now I need to measure it. Here it is, okay. That's a pretty good change in my flow here, so I'm going to left click, hold it down and measure it, and ooh, that is close. Just makes it 10 seconds. So I would score that as an obstructive apnea. So to score that as an obstructive apnea, I can right click, and then on my respiratory, I'm just going to click obstructive apnea. Then click outside of it again, and that epic has been scored. Okay. This patient is in REM. I just pulled this record up. I didn't have it scored at all, so not everything is there. Remember, for your central apneas, it needs to be at least 10 seconds of no movement in your thermistor, nasal pressure transducer, chest, and abdomen. You do not need to have a desaturation with that, but in order to score a hypopnea, we look at our nasal pressure transducer channel. It has to be a 30% or greater decrease with a 4% oxygen desaturation. Okay, just touch on a couple things right quick. Leg movements. Okay, here we do have some leg movements. Again, you have the red dotted line to help you, and we can blow this up to take a better look. So I'm left clicking and then dragging an area, and then it blew that up for me. So I see that the leg movement does go beyond the 2 red dotted lines. If I measure the length of that, that is 1.91 seconds. So that is a definite leg movement. So to score it, I'm going to right click. On my limb movements, I'm just going to mark 1. Okay. There are no arousals on this epic, but if I was to score an arousal, remember it needs to be an increase. If they're in REM, you need to have an increase in your chin as well as a shift in your EEG. But arousals, you hover over arousals and you just mark whichever one you want. To mark your staging, I guess I didn't go over this in the last video, you can do it this way and click on it, or you can just use your number keypad, which is what I usually do because it's easier. Okay, this concludes this little tips for respiratory event scoring, leg movement scoring, and arousal scoring.